You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. Really excited to introduce a colleague of mine, Dr. Rachel Venable. Rachel is a boarded veterinary oncologist, which is a rare thing these days. It's hard to find one. It's a unicorn who has always been surrounded by animals growing up on the farm in the Midwest. She completed her oncology residency in the world renowned Colorado State Flint Animal Cancer Center. She worked in private practice for 8 years and was an adjunct professor in Midwestern University for 5 years before starting Pet Cancer Care Consulting, an innovative teleconsulting service that consults with the family vet and pet owner together to give personalized responses and needed information to make an informed decision on treatment. She's also a VIN consultant and public speaker. Rachel, welcome to the show. Thank you for finding the time.
Oh, thank you so much.
So this is really cool. I mean, the shortage of boarded unicorns is all over the place, and I'm really glad to see the startups and new initiatives that are helping it to scale because you can't be everywhere, and people want you everywhere. So tell us, how did you come up with it, and how does this work?
For me, actually, during the pandemic, I started, realizing more about video conferencing, and I had heard of, I'd used Skype, but I'd never done Zoom or any of those things. So really bringing that technology, and for me also just getting really frustrated. There was such a long wait to see me, which I didn't like. But you're just one person, so you can only do so much. And I knew there was a lot of people that were falling through the cracks, that just either because of the wait, distance, just so many different reasons why they weren't coming in, but they really wanted and needed that oncology support. And with the pandemic and learning more about video conferencing, I really felt that more people would actually be open to telemedicine versus like 5 years ago. I don't think they probably would have. So that's really what got me thinking. The other thing, there's the American Cancer Society, I believe it was, came out and said that about 6 million dogs a year get cancer, which is actually a lot more than people. And there's also about, less than 450 boarded veterinary oncologists. So, you don't have to be great at math to realize those numbers aren't going to add up very well. And so, that was the other thing, hearing those statistics and just realizing, and if I do video conferencing, if I remote to people, I can actually increase the access to oncology. I can do a lot more consults than I could if I was in a brick and mortar building. And so that's what really got me going. I grew up out in the middle of nowhere. I'm from the Midwest, and a very nice rural area. But even for my parents, for them to go see a specialist for their own health, it's at least a 2-hour drive one way. And when you're not feeling well, that's kind of a big deal. So that's the other thing, just increase access to care, I think, is what's really driving me and what's trying to get me, to help people. Because I know there's a lot of people, certainly in rural areas like where I grew up, but even in more urban areas where I am now, the problem is there's so many people that want this care, but they just can't get to it because of the wait mostly at this point.
Yeah, it's so interesting. So a couple months ago, I was in San Antonio, Texas, and was just kind of socializing and ended up meeting a guy who's an SVP at Zoom. And he was telling me about how many veterinarians are using Zoom as a telemedicine platform. It's not really anything that's advertised or that's used, but is that what you're using, or what are you doing? How are you doing these consults? What are you using for a tech stack?
Yes. So I'm using Zoom. I mean, honestly, some clinics prefer Teams. That's a big one. A lot of them use. I can do that. Sometimes we'll use Google Meet, but typically I pick Zoom because it's simple. Most people are familiar with it. Even if the vet's not familiar with it, usually somebody on their staff knows about it. It's been funny. I've had one where his kids helped him do it because they had to do it for school, and I try to keep it all very simple. And also, like, I don't want vet clinics to have to buy equipment or sign into, like expensive accounts or anything like that. Like I've had clinics where, certainly they use laptops. And so what I'm talking about, maybe I'll take a step back here. So the consult, how that works is you can do a consult with me, the vet, and the pet owner. And so one option is the pet owner can come back to the clinic, like a recheck exam. And so I talk to them and the vet over a laptop, tablet. I've talked over people's smartphones. Some clinics will even have the owner bring in their own laptop if they don't really have anything with a webcam. And I've already read through the records. So we just touch base. We have that nice continuity of care, make sure we're all on the same page. I usually have the vet do an exam just to double check any concerning areas, lymph nodes, tumors not coming back, that kind of thing. And then I go into a long discussion about the cancer, testing, treatment, prognosis. Now, for all of that, the vet can be present, or if they need to step out, they can. And then I always type up detailed summary and handout so the vet's still very involved and knows what's going on. So there's that option. The other option I'll sometimes do is more of a three-way video chat. So like where the owner's at home and then the vet comes in and I'm there. And then I just have the vet turn off their mic and video if they need to step away, but they keep it running in the background. So it's kind of that's sort of how I like, so that the vet is still involved and they know what's going on. I think it's hard if the pet owner comes and tells their vet, hey, I found this oncologist online and they told me to do this. I mean, most of the time the vets are going to be like, I don't know what you're talking about. Like they're going to be very skeptical. But if they're involved, then I think that helps. And also they're ultimately the one that's still taking care of this pet. And also having them involved too helps with the telemedicine laws in most states, not every state, but in most states.
Well, for you then, I mean, I've researched the topic a lot because I was trying to stand up even before COVID, the anesthesia consulting, because it's not telemedicine, it's teleconsulting. You're consulting another
Correct.
professional. You could be in Egypt or in South Africa and consult anybody because it's professional to professional. It's not jurisdictionally limited. So that's important to the listeners if you want to use this service. The not serious question that I wanted to ask, if they're using a lot of their kids' computers, have you ever had the transformation like we've seen lawyers becoming a cat on the on the Zoom call, or do you have any experience with that people do something silly like that?
No, I mean, a lot of times I'll even record these. So like if the owners want a recording, they can have it. But the software, I actually have a portal that I use, and
Mm,
that software is HIPAA compliant. Zoom, they're trying to do other security, but as far as I know, I don't think it's technically HIPAA compliant. But as far as I know, too, most veterinary situations, you don't have to be HIPAA compliant. So, but no, I haven't had anything crazy happen with the Zoom. The craziest things I have happen is a lot of the clients honestly are older people. At first I thought maybe it'd be more kind of younger millennials, that sort of convenience
yeah.
techie, but it's actually more older people because they don't want to drive, I think is a lot of it. They don't like change and they don't want to drive. And so they can make it to their vet clinic. And what's funny is they don't know anything about technology. So half the time I end up talking to foreheads, or
Yes,
this
that's my
one
favorite.
gal, she moved the camera so I could see her dog. And then the dog, of course, ran out of the view and she didn't adjust the camera. And half the time they're not seeing how they look. And it was actually just like part of her chest that I was talking to. So that, so you
Yeah,
learn to just like not do the same eye contact that you used to, you know?
we had a call with a group of lawyers. It was a very serious call. We were talking about investment, and one older lawyer, he didn't use Zoom holding phone in front of him. He used it as a phone. So the whole meeting, we had five lawyers, two companies, and an ear with a very hairy ear canal, so we could see.
So funny. I've got another question for you, Rachel. So my question is, what does this look like in a couple of years? Like, what's your vision for your company? Where do you want to take this thing? And I guess the reason I'm asking is we've saw a lot of like teleradiology and other segments of veterinary care kind of really leverage technology and the ability to kind of work and be anywhere. So what are your big plans for this company that you've built?
So I really like it to grow and to become one of those, where family vets know this is kind of that extra tool in their tool belt, that they could easily access. And so my hope is to have other oncologists eventually, consulting and trying to, really reach, because most of the nation, I can do this, where it becomes a little tricky and kind of the gray zone is because I'm talking to clients. I have the vet there. So it's still, like you said, it is teleconsulting, which is different than telemedicine, but it's something where the owner's still there. So some states like California, I can't actually do this. Now I can consult with the vet. So I do have other options where if vets have questions or if they would like me to type up a big summary, like I can do those things for them. But as far as talking with the owner, sometimes that can get a little tricky, but it's certainly still something I'm hoping to do this nationwide and maybe bigger. Again, it just depends on getting through all the legal stuff.
So are you planning to grow your team because you're a one woman show? And do you think that that you can hire other oncologists to join you in this? Because then you will reach the scale and sort of the alignment there. So is there a plan like that?
Yes, right now I'm still really kind of building the concept. I think, trying to get the word out, get, kind of proving that this can work. But yes, I'm definitely wanting to get other oncologists. I've actually had several oncologists reach out to me. I think it's something that a lot of them are interested in. The problem is, as you guys talk about a lot, right? There's burnout. People kind of want some time away from the clinic. With this option, I still feel very clinical. I'm still talking to people about a lot of cases, doing similar to what I did before, even, protocols and dosing and drugs. So it's just not physically in the clinic, but my mind, it's still doing a lot of the same clinical things. So yes, I've definitely had quite a few reach out to me. Like I said, right now, I'm still building and kind of proving the concept, but I'm hoping to start, adding other people in over time.
Yeah, it's really interesting. I had a former business partner, Dr. Brian Poteet. He had built a teleradiology company that later went on to sell to Pathways, which is now Thrive. And just watching him grow that business was fascinating because they had this just funnel that was as big as they wanted it to be. And the problem that they always had was, supply and demand. They had all of these cases, and I remember we'd go to conferences and he'd be up in his room reading radiographs at 12 o'clock at night to get through the massive caseload that they had. And it's a really interesting kind of way to look at this business, because if you're anywheres and you can have all this caseloads come in, is it harder to manage like a 9 to 5 day when you're doing this in this electronic medium as opposed to the way that you used to do it? And how have you managed to kind of like have a home and a business life, and have you managed to separate them at all? Sorry, that's like 6 questions, but I think you get it.
Right. Yes. So, as far as comparison, I mean, it is different. Obviously, it's quite a bit different than which I wouldn't call it a 9 to 5. I wish it was a 9 to 5. It was probably more like an 8 to 7. But I mean, now it's got its own challenges because I'm building all of this. So, I'm doing the reception work and the back office work, versus, and eventually that stuff that I plan to have hire out too. So, but right now, balance it seems to be pretty good. I am trying to be aware of that. I would say personality wise, it's easy for me to turn into the workaholic, right? I feel like to get to the level, of a lot of it, all the vets. Like I remember when I was in high school following vets around, I remember several of the vets telling me after vet school, you're going to be a workaholic. And I remember thinking that was kind of strange, but they all were. All the vets that I followed, I'm from a rural area, so they were all mixed animal vets. So they're, farm calls and in the clinic, and they were on all the time. But it is interesting. You don't realize it, but it's like you just keep pushing and pushing because that's how you get to those levels, especially after internship. I mean, that's kind of the max. And then residency. So yes, so it's something I think as you get through that on the other side and try to mature and things, I definitely trying to find more of that balance. So I do feel like this helps to have a better balance just because my schedule is so much more flexible. Like now I'm able to actually go and do some of the reading groups with my daughters in elementary school. So I can actually go and do that. I can take, half an hour and run over there and read stories with them and then come home, versus before it was just really hard. Even though technically I could do it, I would always have clients and staff kind of chirping at you, right? Because they're like, you can't leave, you've got all this stuff and you can't come back. So I do feel like I have a lot better balance. It is different because sometimes my hours can be a little bit different to get things done. With this right now, especially with the video consult, that is still on a schedule. So that's a little bit different. It's not the full asynchronous, like what you're talking about with the x-rays, where you just kind of get it done when you can. Right now, I'm still doing the video chat. I know some other groups are trying some different things. But to me, especially that initial oncology consult, people really, I feel like just need to hear, it needs to be a conversation. So whether they physically see you or if it's over the phone, but I find that one's really hard to do, to just type it up if you're including the owner. Now the vet, you can just type it up. But the owner, I think, because they have so many questions and things, it would be kind of hard to do in like a text format or just a typing back and forth.
Such an interesting that angle that you added about the clients into this, because there's a couple of startups that we talked to. Well, it's not a startup anyways, big company, VetCT. They have multiple specialists that are working for them, but it's interesting. I'm very interested in burnout in our domain, and I've been doing a lot of work, kind of studying it and understanding. And what's interesting, what I'm hearing is that even though maybe the workload increased because you're now working for yourself, but it's more rewarding because you're doing like sort of a different passion, different direction. You change you change the trajectory as a vet. But for availability and how this works, because I want everybody who's out there to understand how to engage with this. Because the way I'm seeing it, so we're building a group, we're building Galaxy Vets. I don't know if you heard about it. We're building this sort of burnout-free organization. I think this is an incredible access to care that we can provide using service like yours, where basically in every hospital, every GP hospital that joins our group, they don't have to look for a specialist if there's service like this available, and they can experiment with their own oncology conditions being treated with your help. So how would that look like for a veterinarian? Is it the website that they go to? Do you have to be in the referral group? Like, how does the whole engagement, how do people find you? And then what are the steps? Sort of, what is the process like? Can you talk us through it?
And feel free to be very specific, because I'm sure we've got lots of listeners that could use your service.
Oh yeah. Yeah. Prepare your pens and notebooks. So this is the information you need.
Thank you. Yes, so my website is the best place to start, and it's kind of long, but it's straightforward. It's Pet Cancer Care Consulting.com. So I know it's a mouthful, but it is what it is. Like, you can tell from the name what I'm doing, so Pet Cancer Care Consulting.com. Through the website, it describes basically how this works. So essentially the video consult with the oncologist, the vet, and the owner. There's also the other options, like I said, where I can do more of that asynchronous messaging with vet clinics. So just more of the messaging back and forth, or a detailed consult and things. And so for vet clinics, what they need to do on my website, there's a tab that says Vet Portal. And if they click on that, they can actually register to be in my portal. And it's free, and the information, really, I just need contact information. And basically ways that I can easily identify that you're a vet and not a pet owner, because it is for vets. And inside my portal, it's pretty easy, but I'm always happy to help. But essentially, there's icons you can click on to schedule a consult, or if you have questions, or all those different things. So it's pretty easy, click step by step. And all the pricing and everything is also in the portal. I do that because since I'm a consulting service, I actually charge the vet clinic, and then they forward that on to the client, kind of like you would any other lab service or that kind of thing. So I have all that, again, in the portal, because I want clients to be able to look at my website, understand how this works, see if that's something they're interested in. But I don't want to mess with paying for prices, having that, dealing with that part of it.
Yeah, that's super great. I think transparency in this day and age is like really impactful, and people really like it. Rachel, we burn through all of the time that we have. We do this every week. It's so quick, but it's really fascinating what you're doing. And we really want to follow your journey as you kind of go down this, what some describe, including myself, as a crazy path of entrepreneurship, because it's hard and challenging. But I think you've really got something here. So good luck.
Yeah.
We always like to kind of wrap up the same way. So we've got a couple questions for you. The first one is a book, a YouTube video, a TED Talk, something that you found inspiring that you'd like to share with our listeners.
Yeah, the book I like is it's called The Road Back to You. I know you guys can see it, but the listeners can't. It's an Enneagram. I don't know if you guys follow that, but when I was kind of in my career and sort of feeling frustrated just about things, and I wasn't really quite sure what it was, and just this extra stressor, going through this, it's sort of just a different personality type test. And so it helped me really learn more about myself, and has really helped me in this journey, because now I kind of understand more about what works for me and what doesn't. What are some of my strengths and weaknesses?
That's great.
And the second question that we usually ask, do you know anybody who would be a good guest on this show?
So the person I recommended isn't your typical guest. It's Doug Pham. He's one of the professors at Colorado State. He's not in the technology world, like I feel like a lot of your guests are, but he's actually done a lot of drug development in oncology, and he's one of the big brains, they call, with oncology. And so he was involved with really the creation of one of the first chemotherapy drugs approved for dogs. It's called Tenovia. So I think he would just be an interesting guest to have that be a little bit different than some of your others.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.